Hello, guys. Welcome to my channel, insurancewiseusa.com. If this is your first time here, welcome. Please, if you would, below this video is a like button. So be sure to hit that and also hit the subscribe button. That's like probably right about here. Okay. So it's important that you do that because what that does is it actually builds algorithms so more people can come and take advantage of these videos. So these videos are free and I put them on here for your benefit so that you can learn and it's easier for me to actually reach out to my client base. So who I teach these things in person. So this is about as close as it gets. So with that being said, again, if this is the first time here, I'm going to I'm going to actually start sharing this video with you so that I can walk you around. And we're going to talk about today, we're going to talk about Advantage plans versus Medicare supplement. So uh, I do a lot of Medicare business. I know a lot about both of these products, and I'm going to walk you through it today. Things to look out for, things that you should know, and you can take notes, or you can come back to this video anytime you want, watch it all you want, and then go back to the parts uh, that you want to remember. So, with that being said, let's share my screen. And if you guys haven't been to my webpage yet, my webpage is insurancewiseusa.com. So to come to my YouTube channels, it's insurancewiseusa.net. Okay. And that's going to take you right here, which is my YouTube channel. So insurancewiseusa.net. So right now, I currently have three different videos up. So AEP annual election period for 2022. This is going to change. I've actually got the information to do it for 2023 now. And some good news, some of the prices have actually gone down, not up. So that's good news for you guys. But it's not really significant, but there's no price increases really. The prices have actually gone down and there's some good benefits in there. So then we have understanding Medicare part A, B, C, and D. Okay. This one's also going to change because of the different numbers, different values coming into 2023. So this video here just talks about my webpage and that I do more than just Medicare. I also do cancer policies, long-term care, life insurance. I am a big believer in index annuities. If you have nest egg money and you have it tied up into the stock market, if that stock market crashes, index annuities are a good way to protect that investment, protect that nest egg. So with that being said, we're going to move on to the PowerPoint presentation. Again, guys, what I want you guys to do on this particular video, let me just pause it for a minute. This is the annual election period video, but I brought it up just so I can point out to you guys. And I'm gonna, let's see here. Right here, okay, guys, come over here and hit that like button and then hit the subscribe button. All right. So hit these two. This is free information to you. So please do that so that we can get this word out to a lot of people. Then if you click on that little bell right there, every time I add a new video, which is going to be valuable, guys, it's free information to you. You'll be notified of a free video, a new video that I put on there. So please go do that. And then we'll just get started with the course. Advantage plans versus Medicare supplements. So let's go back to our mouse. Let's see what we got here. Okay, we're not here. Annual election period, and we are sharing. So good. Okay, so here we are, guys. So this is what we're talking about today. We're talking about supplements versus Advantage plans. So we're like today is October 4th, so we're a few days, a couple of weeks away from the open enrollment period for Medicare, and that goes from October 15th to December 7th. Okay, so right off the bat, what I'm going to do is prepare you guys and say, don't listen to the Medicare hotline, because what happens is it's like fishing. You put a nice tasty treat on the end of a hook, and they want you to bite it and reel you in. So they're going to promise you a lot of sweet things, a lot of nice things, and a lot of people get hurt when they make these changes. So if you are a dual stipulation plan, meaning that you qualify for Medicare and Medicaid, or your chronic illness, uh, those plans are unique and tailored to you specifically. That's not an area that I really work in. I really work with just Medicare Advantage, Medicare supplements, uh, ultimately because the special election periods with these particular products are limited. So, but if you ever have any questions or need some information, I'll be happy to get you answers, help you out, or even enroll you. So, whatever it is that you might be interested in. So, anyway, let's go. With that being said, I could go to the slides and do a slide presentation, but I like to have the slides over here and move through them as I click on them. Okay, so let's just look at slide one. We're going to talk about some advantages and disadvantages to uh, Medicare advantages and supplements. Okay, so breaking down Medicare supplements, we're going to start there. So when you come into Medicare, you have Medicare A and B. You got to have those. Okay. So if you have Medicare A and B, you don't have to really have a supplement. You don't have to have an advantage plan. But one of the problems with just having regular Medicare is there's no maximum out-of-pocket costs, meaning that if you get sick or you get hurt, that cost can escalate, and there's no cap on it. So it just makes sense to get in one of these two options. Okay. So up front, we're going to talk about Medicare supplements. So Medicare supplements are actually funded by the government. That's why a lot of doctors like these. So when you have a Medicare supplement, if you have a doctor that accepts Medicare, then he's going to accept your Medicare supplement. It doesn't matter if it's with United Healthcare, Humana, Aetna, whoever it might be, Florida Blue. If he says he accepts Medicare, then they accept your Medicare supplement. Where people get confused with this is that sometimes the doctor or the receptionist at the front is going to say that we don't accept United Healthcare, and that's because they may not have paid their bill for the Advantage plan. Because the difference between a supplement and Advantage plan is a supplement is paid by the government, okay, or the first part of it that Medicare A and B is paid by the government. The supplement itself that pays for what Medicare is not paying for is paid for by uh, the insurance company. Okay. So, but when you're with an Advantage plan, the private insurance, the insurance company picks up all those costs. And sometimes they're subsidized by the government to do this. So they're actually responsible for paying those bills. And sometimes they don't pay those bills because these are for profit companies, right? And they want to make sure they're in the black. So if they can stretch some of those payments out, they're going to do that best way they can. And at times, those doctors don't like that. They don't get paid, don't get paid on time. So they refuse to take service from them. So that's something to keep in mind. So anyway, let's kind of go over the advantages of a Medicare supplement and some of the disadvantages. So if you have a Medicare supplement, the best one currently out there is Medicare Supplemental Plan G. Okay. It covers everything but the Part B deductible, which is an annual deductible, and it's new here. There's a new deductible here in 2023, and I go over that in my Medicare 101. So it talks about all those different costs. So, so let's see where we're at here. So with a Medicare supplement, you can go to any doctor in the U.S. if they take Medicare. All right. So meaning that that's Alaska, Hawaii, California, anywhere you go. If you like to travel a lot, you're going to want to have a Medicare supplement because with a Medicare Advantage plan, you're either in an HMO, which is a network plan. And if you leave that network, you weren't going to get coverage unless it's an emergency. Okay, now you can't have a PPO, which allows you to go outside of that network, but then your costs can double, and so can your maximum out-of-pocket costs. So with a Medicare supplement, you can go to any doctor, any place in the United States that takes Medicare, and you have a predetermined cost. So if you have a Plan G and you're going to a Medicare doctor, your only cost with that plan is going to be the deductible for the Part B and your monthly premiums, whatever they may be. So we're going to talk about that a little bit more. So uh, that is one of the disadvantages of a supplement is you have a monthly premium. So let's see here, monthly premium. Uh, Also, another advantage is if Medicare covers it, the supplement will too. So a lot of times the general rule that I tell my clients is this: with Medicare, if Medicare spends one penny toward a procedure, then the Medicare supplement's going to pick up what they don't pick up. So if Medicare doesn't spend at least a penny on a charge, then it's not covered by Medicare, and the supplement's not going to pick it up either. Okay, so quarterly or monthly, you should be getting a quarterly summary report, monthly summary report, where you're going to be able to see what Medicare is approving and not approving. So if you see charges that show up and they're not approved, you want to make sure they're coded correctly, that whatever the procedure they may have done is the right one that's covered by Medicare. So those are all questions. If I was your agent, you can come to me and we'd be able to answer those for you. Uh, but still the same, Medicare supplements are pretty consistent. You know what you're going to be spending. So with a Medicare supplement, there's no networks. Okay, great if you travel a lot. No need to change anything if you move. That's another beautiful thing. So you're not in a network, so anywhere you go, you're going to be able to take that plan with you. It doesn't change. You even get to keep your agent if your agent is only licensed in Florida, for instance. Okay, and you move to Michigan or Wisconsin to move back in with your children or move close to your children, you can take that plan with you. Nothing needs to change with that plan. Okay. So those are some big time benefits with supplements. Let's look at what's important to know about a Medicare supplement. So one I have here, Medicare, we already talked about, pays only one penny toward the procedure. Your supplement will then cover according to your chosen plan. So G being the best, N is a pretty good plan. I like that. If you talk to me, I'll give you the breakdown of that. So it's going to cost you less for a premium. It's a pretty good plan. So G currently is the best plan it's offered. If you turn 65 prior to January 2020, you can still get the F plan. So the F plan actually covers the Part B deductible. They did away with that after 2020, so you won't be able to get that. Okay. So let's see, I have here, if Medicare doesn't pay anything toward a procedure, neither will the supplement. So these are important things to know about your Medicare supplement. If you leave a supplement and you get sick, all right. So say for instance, you're in a Medicare supplement, you see one of these Medicare helplines promising you free food, free rides, free whatever, and you're in a Medicare supplement and you decide you want to get out of that Medicare supplement, and you're a couple years into your supplement, but you want to save some money, and then 6 months down the road, you get sick, you have cancer, and you find out that Moffitt Cancer Center is not covered by your Advantage plan. They don't take your Advantage plan. So, or you got costs that are starting to escalate because when you go into a doctor, that doctor sends you from your primary to a specialist to another specialist who then sends you to x-rays and then sends you to lab work. These are all extra costs that add up because Advantage plans are full of copays. Okay, copay, 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 copay until you get to your maximum out-of-pocket limit, and then it ceases. But that can be as much as $10,000 if you're out of network. So keep that in mind. Those are some disadvantages to the Advantage plan. So with supplements, your costs are easy to determine because it really comes down to your monthly premium. So if you have a Plan G, you can take your monthly premium times it times 12 and add your Part B deductible to it, right? Which is not a lot of money. We're talking in the $200 range a year. All right, not a lot. So anyway, some plans have a $50,000 emergency travel fund, meaning that if you go overseas and you travel, they're going to give you that money so you can get back to the United States. So that's a good benefit to have. I mentioned again, most people want a supplement once you get sick. So you go into an Advantage plan and then get sick, and then your costs start escalating, and then people want to come back to a Medicare supplement. Well, sad news, guys. Once you're out of your initial enrollment period with Medicare, you have to go through underwriting, Medicare underwriting. And when you do that, if you have a condition like a heart attack recently, or you have cancer, or you have some major illness, you're not going to be able to get back into a Medicare supplement. So they're going to deny you. So that's important to know. So keep that in mind. So moving on from that, let's talk about the Advantage plans for a moment. Let's talk about some of the advantages of an Advantage plan. So again, this is private insurance. The Advantage plans were created ultimately to take a lot of weight off the federal government, so that private insurance would pick up a lot of this. So in return, what the government does is they are subsidizing these insurance companies for every person that they pull away from Medicare. Okay. But now you ultimately are the property of that insurance company. Now you are still responsible when you go to an Advantage plan to pay that Part B premium. You are going to pay that. So, but most of these plans today, a lot of these plans today don't require a monthly premium for the Advantage plan. Okay. So ultimately, you're just going to pay for the Part B monthly premium. But let's look at some advantages. So no premium for prescription drug plans when enrolling in an MAPD. Yeah, most plans include a prescription drug plan, which covers generics, at a very low cost, tier 2, 3, and all the tiers of drugs are going to be covered with an Advantage plan. Now, if you're in a Medicare supplement, you have to have a standalone prescription drug plan, unless you have one better ultimately through a company that your husband might be working for or something to that effect. So, but if you're in a supplement and you don't get in a prescription drug plan, you could be penalized. So, but there are plans as little as $7 a month, guys, for a prescription drug plan just to satisfy that penalty. So, and there's a lot of different plans out there, but we're talking about Advantage plans right now. So with Advantage plans, you'll get basic dental, basic vision, gym memberships, hearing aids, and rides to appointments. Sometimes you get meal cards. Sometimes you get money for over-the-counter drugs. So this money all comes from the subsidies that the government is giving to these insurance companies. But let's talk about how it works here. Okay. Ultimately, in Advantage plans, you have HMOs right here. Let's see if I can get my drawing stick here. We have HMOs right here and PPOs. Okay. So HMOs are network plans. Okay. That means that you come into an HMO, you're going to be in a network. They're going to tell you the doctors you can and cannot go to. So keep in mind, this is where all the freebies come when you're signing up for an HMO. Okay. And the reason for that is because they're negotiating cost with these doctors. So they've negotiated them so far down that they can profit or make a profit to give you more benefits inside of these plans. But sometimes what you end up doing is you end up giving up quality in your healthcare. Okay. A PPO, on the other hand, will allow you to go outside of the network. So PPOs mean that if a doctor accepts Medicare, then he's going to take your plan. So if it's not in the network, however, you're more than likely going to pay double the cost. Okay. Times 2. All right. And we're talking about, let's see, I'm not a very good drawer here, but this is the best I can do with this pen. The MOPE is your maximum out-of-pocket cost. Okay. This cost right here, ultimately with the PPO, if you go out of network, like if you're a traveler, this is why a supplement could be better for people who travel a lot, because your costs are consistent. But if you're out of network and you get sick, you got to go to a doctor. You're talking about, if you have a $5,000, and these plans change these out-of-pocket costs every year. So you have to pay attention to them because those are benefits. But that $5,000 maximum out-of-pocket cost you may be paying with a plan that you got into with a PPO, when you're out of the network, could move up to as much as $10,000, okay, or more, because that's not the ceiling, okay? All right. So just keep that in mind that those are disadvantages to advantage plans, okay, that a lot of people miss. They don't talk about those, okay? So let's see here. The other thing is the high out of pocket cost, right? Oops, sorry about that. So you have high max out-of-pocket costs. That's not so much the case with HMOs, not with HMOs. HMOs have low maximum out-of-pocket costs. Uh, They have low maximum out-of-pocket costs, but you're in networks, right? So they're going to tell you which doctors you got to go to. They can determine ultimately where you're getting your care, and they're able to will and deal to get those costs down, so they can actually lower your maximum out-of-pocket costs, and they can give you more freebies and more benefits. Okay, so these plans are great. I found these plans are great for people who just, some insurance is better than no insurance. I've always said that. So people who don't even care, they haven't been to a doctor and they turn 65, now they're eligible for Medicare, or maybe they're on a disability, but they never really cared who their doctor was. Well, these plans are great for those guys. So they're going to go and they're getting all these freebies. These plans are great for those people, who don't care who their doctor is. They don't really travel. Then an HMO would be perfect for those guys. Okay, so PPOs are pretty good. They're not bad. They're good for people who might like to travel, but not want a monthly premium. Okay, added to their cost. So those plans are good until you get sick. If you get a real bad sickness, then those costs are going to add up, and that's when people want to move to a Medicare supplement. Okay, so just keep that in mind, guys, as you guys are looking at the differences during the annual enrollment period. Okay. So again, advantages, money cards for meals, such as over-the-counter drugs. So with Advantage plans, you're going to find these with mostly HMOs. Okay. So these are going to be your HMO plans. Let's see. HMO are going to give you the free meals and over-the-counter drugs, or what they call Medicare money, things to that nature. Okay. So I like playing around with these little erasers and pens and stuff. So, but let's see here. So disadvantages: HMOs, you have to stay in the network. PPOs cost double outside of the network. Your doctor sometimes will not accept. Remember, keep in mind, right here, this is a big one. You walk into your office and your doctor's office and you see a sign up there, we're no longer taking Florida Blue, or we're not taking ARP. They're not saying they're not taking your Medicare supplement, guys. They're saying they're not taking your Advantage plan. And the reason why is because that insurance company was not paying their bills, more than likely. So those doctors are not obligated to hold on to that service. They can stop that service anytime. You're not going to run into that problem with the supplement, okay? Because that bill's going to get paid. The doctor knows the bill's going to get paid, so they don't deny Medicare supplements. They can actually start denying Medicare Advantage plans at any time. So high max amount of pocket costs. Again, that's the difference between a supplement and an Advantage plan. Now, you're not going to have a high max amount of pocket costs with an HMO. We talked about that because there's a bunch of freebies. They've talked those prices down. You're going to their doctors, you're going to where they want to go. So you're going to get a lot of freebies and you're going to get a low max amount of pocket costs, but they pretty much control you. They're going to tell you where you got to go, and they're going to take care of you. Those plans can work really, really well. I found they work great for low income people, people who don't have a lot of income. Okay. So just keep that in mind. Again, if you're sick, you're likely stuck, cannot return to regular Medicare. That's another big point. Note of interest. Okay, and can only change during your open enrollment period unless you have a special election period. So a special election period would be if you're in an HMO or PPO, you move. Okay, if you move, then you have to get into a different network. So you're going to have to, that's a special election period. So you can actually change plans if those kind of things happen. So that's a good example. Okay, just it's probably the most popular is that somebody moves. All right. So let's clean this up here and we'll move to the next slide. All right. So, all right. So let's see here. So we've been talking about HMO, PPO. Some of this stuff is redundant. I realize that. So, but I want to get this ingrained in your guys' mind so you understand the products that you're getting. So when that Medicare helpline, Joe Namath and his buddies, they come on TV, they start talking to you about it's free, free meals, free this, free that. Okay. Know the difference. Know what you're getting, guys. Okay. HMO to PPO. Okay. Now they may likely have both of these products. They may even have supplements. But what you're not going to get is you're not going to get an agent like me who's actually going to have serve as interference with these insurance companies. One of the benefits that I give to my clients is I stay in touch with them. Okay. I send out monthly newsletters. If there's changes to Medicare, I'm going to try to update them. If they run into a problem with an insurance company, they can talk to me. And when you're talking to me, I have a history on you. I know you're not brand new to me. I have a history with you, so you don't have to keep talking to somebody new and repeating your story, and that should be very helpful to you. Okay, so anyway, HMOs to PPOs. All right, so HMOs are network plans. PPOs, you can go to any doctor that takes Medicare. Uh, Disadvantage to HMOs, doctors, hospitals can drop you at any time. Okay. Quality of care. Okay. Now these plans have to be ranked. So they can be pretty good because not a lot of people are complaining about them. But in the HMO, they may send you to a doctor that you're not too crazy about, and you want to keep your own doctor. Okay. Lots of freebies with HMOs. Okay, this is what they're encouraging you to move into when you're listening to the Medicare hotline. Can't use out of the network unless it's an emergency. This is big. If you're a traveler, you don't want an HMO because with an HMO, you have to stay in network. The only time you're going to be able to use this plan if you leave the network is if you go into the emergency room and they admit you. Okay. Oh, this is an advantage to Advantage plans or an HMO. Some HMOs actually give you a portion of your Part B money back. All right. When would that be good for you? Well, that's good for everybody, right? But again, if you value your health care, you really don't want to be an HMO. Okay. But if, let's say you can't afford insurance, you don't have insurance, you don't have very much money at all, you don't qualify for Medicare, okay, or Medicaid, I should say. So you're like just past that threshold. You don't qualify for Medicaid, and you really don't care who your doctors are, and you don't travel a lot, and you want some money back that Medicare is going to take from you from the Part B money that you're going to pay anyway. Because it doesn't matter whether you're in a Medicare supplement or you're in an Advantage plan, you still have to pay this Part B premium. Okay. You're going to have to pay that. But some of the HMO plans will give you a portion of that money back. Okay. That's a good deal for some. So there's a good fit for people with that. Let's take a look at the PPOs again. PPOs allow you to go to any doctor that takes Medicare. Costs sometimes double outside of the network. That's important to know. Okay. Maximum out of pocket costs much higher than HMO. So these are better plans because you go to any doctor, any place out there, they can't negotiate some of those costs. So you're going to spend more in a PPO, but you get more freedom. All right. You get to do more in these plans. So not as many freebies. Why is there not as many freebies? Because you have your choice of doctors. You're getting to go to the doctors you want to go to. They can't tell you where to go. So they're not necessarily talking those guys down. All right. Again, even with a PPO and an HMO, doctors can drop you at any time. All right. They don't have to stay with the plan. If you walk into your doctor's office and they decide, hey, we're no longer taking that plan, well, I guess that's a special election period for you, maybe, or you got to go find a new doctor. And that's not really a problem that most people want to have. Okay, let's go to the next slide. Important to know about Advantage plans. Okay. If you have an Advantage plan, we're talking about copays, okay? You're going to have zero premium. That's the big thing that people like about these Advantage plans is that there's zero premiums, okay? But with those zero premiums come a lot of co-pays. All right. You may not pay anything to go to your primary physician, but you're going to pay to go see your specialist. And that specialist may send you to go see an x-ray technician. All right. And that x-ray technician may send you somewhere else, and they may send you to the lab. And all these things will build up your copays. Those copays start adding up. Okay. So, and I've heard with a lot of people too, these Advantage plans may give you hearing aids, but the good hearing aids out there, because sometimes as much as $5,000, right? And sometimes they only give you like 2,500 a year. So keep that in mind. Those are things that you want to be mindful of. So, but anyway, all your copays are going to be listed in your summaries of benefits. So if you have an Advantage plan, this is where you're going to find out all your costs for every procedure that you have. So you want to make sure you get that. When you get an Advantage plan, you want to make sure you have your summary of benefits so that you understand and know exactly what those costs are. So we already talked about copay. So this is where these Advantage plans start to add up. Keep in mind, when you have a supplement, you're paying a monthly premium for a supplement. And if you have a G plan, you're only paying for that deductible, that annual deductible, which is right around $200 a year. I don't remember. I just got the numbers for 2023. That's why I'm not mentioning them. You can see it in my other video, Medicare 101. But you can determine what your costs are going to be because you're going to be paying a monthly premium. You have your deductible. After that, Medicare is paying for everything that, or your supplement's paying for everything that Medicare doesn't pay for, as long as Medicare spends at least a penny on that procedure. Okay. If they spend money toward it, they're going to pick it up. If they don't spend any money toward it, being Medicare, then it's not a Medicare covered procedure. Okay. So it doesn't matter which plan you're in then. Okay. So all the freebies generally mean you're enrolling in an HMO and now in a network. So that's something to keep in mind as you're listening to the Medicare helpline. So if you leave a supplement, you get sick, you may not be able to return to a supplement due to underwriting requirements. So always keep that in mind. So you might get tempted when you watch these commercials, you hear these guys go, it's free, milk cards, all these questions. You're getting all these freebies. Well, what you're giving up is your choice in doctors. Okay. You're giving up some of your freedom. You're giving up higher quality healthcare, so to speak. So you want to keep that in mind. Okay. With an Advantage plan, it's hard to determine your cost. These costs can add up when you're sick. So I had one of my clients say, I like a supplement because it's either pay now or pay later. Okay. But if you're paying later, right, then you're likely in an Advantage plan, and that's when you get sick. And when you get sick, then people want to go back to a supplement. All right. And that's when it's going to cost you because you're not going to be able to do that. Okay. Advantage plan is probably not the best plan if you're a traveler. Okay. If you travel a lot and you're going into an Advantage plan, you want to be in a PPO. Don't go into a HMO. So because HMOs are network plans. So definitely here, if you're going into an Advantage plan, you want that to be a PPO, no HMO. Okay. The other thing too is if you have a history in your family of cancer, or if you're worried about cancer, there's a lot of these Advantage plans. For instance, I live in Florida, all right, Southwest Florida, and God bless all you guys who are still suffering from the hurricane. Hurricane Ian, but Moffitt Cancer Center up in Tampa, they don't take many of these Advantage plans. They won't take them. So that's important for you to know and understand and look at those options. If you have a Medicare supplement, this is not going to be a concern. Okay. And if you actually have an Advantage plan and you end up with cancer and you're in a plan that Moffitt Cancer Center doesn't take, then you have to go where they're going to tell you to go or find a different place to go that does take that plan. So that is never a worry with the supplement. Okay. And you can ask any doctor, any nurse, if they said, what What do you prefer? Do you prefer supplements or Advantage plans? The doctors are going to tell you Medicare supplements over Advantage plans all day long, and the reason for that is because they get paid. Okay, the bill gets paid when you have a supplement. So, if you are picky about your doctor of choice, this may not be the plan for you. So again, we talked about that a lot. So these are just things to know. Let's clear this up and go to the next slide. Let's see where we are. Mouse. Okay, so in closing, uh, let me help you guys make the right decision. I hope this information helped you. I hope you got something out of it. And as you're moving into the annual enrollment period, which is another video that I do, it's going to lead people to this particular video, and they're going to learn something about the differences between Advantage plans and supplements that should be beneficial to all. So it's very important, guys, that you come. I'm going to show this to you guys again because it's important. Okay. Let me take this pen here real quick. But what I want to do is I want to hit more. Okay. We're going to scroll down. So this is one of my other videos. I think this is my annual election period 2022 video where I talk about a little bit about what we're talking about here. But what you want to do is you want to come over here and you want to like this video. Hit this like button. Then you want to hit this subscribe button. And then you want to hit this little bell. This little bell is going to tell you when I put a new video up, okay? And that video could have some good information for you. So hit that so that you're notified when a new video is up, what it's about. So this is my webpage, guys, and this is how to get a hold of me, okay? This is my email, James Laughlin at insurancewise as in wisdom, USA.com. And this is my webpage, insurancewise.usa.com. You guys are all welcome to get a hold of me or text me at this number. Okay. So again, in closing, I hope this helped everybody out. I hope it clears up some confusion for you. If not, reach out to me. But if you haven't done so yet, before you leave, please hit that like and subscribe and the bell icon. Okay, guys. Hope everybody's safe out there who suffered through Hurricane Ian or Ian, however you might say it. And I will be hearing from you and talking to you later and in the future. Until then, let's make it a great day. I'm going to stop in this video. Bye, folks.